Hello, I'd like to tell you about a very exciting opportunity from the University of Maryland, Baltimore, and that's the brand new and super exciting online Master of Science degree and graduate certificates in palliative care. I'd like to share a few aspects of this program with you. My name is Dr. Lynn McPherson, and I'm a professor and executive director of advanced postgraduate education in palliative care at the University of Maryland School of Pharmacy, and I'm the program director for this interprofessional program. Now, I'm sure everybody knows what palliative care is, but it's always good to begin at the beginning. So here's the definition of palliative care from the World Health Organization. Palliative care is an approach that improves the quality of life of patients and their families facing problems associated with life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. Boy, they sure packed a lot into that long sentence, didn't they? So the important thing here is we're talking about quality of life. The center of care is the patient and their family. We're looking at people with advanced illnesses, serious illnesses, possibly life-threatening, and looking at detecting and preventing and treating any kind of suffering, whether it's physical, psychosocial, spiritual, financial sometimes we can help with, whatever it may be, to ease the patient's transition and to help with whatever is bothering them. So what exactly is the deliverable that we're talking about here? Well, the pinnacle here would be the award of a Master of Science degree in palliative care. However, as you move through the program, you have the opportunity to pick up additional graduate certificates. For example, if you finish the first 4 courses, you are awarded a graduate certificate in Principles and Practice of Hospice and Palliative Care. You may choose to end your training at that point, or to take a break, or preferably to continue on your path to completing the Master of Science degree. We have a whole range of elective opportunities for you to select from, and depending on how you structure your elective choices, this may result in the award of a second graduate certificate. And the possibilities include clinical hospice and palliative care, leadership and administration in hospice and palliative care, psychosocial, spiritual aspects of hospice and palliative care, and aging and applied thanatology. So I guess the big question on everyone's mind is, why the heck should I do this? Here I am, I'm a busy adult, I've got my job, I've got my family, I have 500 things going on. Why would I want to stop and get a Master of Science degree in palliative care? I think there are a lot of reasons why people should consider this kind of a very flexible program. Certainly it's designed for people who are already working in the field of hospice and palliative care to give them that greater depth of knowledge and understanding and to refine their skills to work in an interprofessional, transdisciplinary environment. Perhaps it could be used to secure a job that's a career advancement. But I also think it's important for folks who may desire to start working in the field of hospice and palliative care. Also, it's very useful, particularly for physicians who want to transition into hospice and palliative care mid-career, but they don't want to put their career on hold and take a year off to complete a fellowship. Instead, they can complete this Master of Science degree, and then they'll be in an excellent position to take the Hospice Medical Director's exam. I also think this master's degree really does an exceptional job of complementing the skills that practitioners already bring to the table, those who work in different fields. For example, practitioners in primary care, those in the hospital, oncology, intensive care, emergency care. Increasingly, no matter what someone specializes in, palliative care is becoming more and more of their job and what they do every day. So to have these additional skills would be a tremendous boon. And most importantly, or not by all means not least importantly, is anyone who takes this master's degree will be well prepared to take the hospice and palliative care certification exam of their choice that is relevant to their profession. So lots of reasons why I think, of course, I think this is a wonderful idea for a career advancement and satisfaction with your career. So who specifically should consider enrolling in this program? Well, as you can see, this program is geared for the whole team. It's not just certain practitioners. We practice in an interprofessional environment, so we should train the same way. So I believe physicians, pharmacists, nurses, advanced practice nurses, physician assistants, therapists, whether it's PT, OT, speech, psychologists, administrators, social workers, chaplains, counselors, bereavement specialists, volunteer specialists, and thanatologists. So again, we really believe strongly in the whole team approach. So how was the Master of Science degree and the graduate certificates designed? That's an excellent question. We spent a lot of time doing curriculum development and curricular mapping. Whenever you're designing either a whole program, a whole degree, a course, or even one educational activity, you always begin with the end in mind. What do you want your graduates to be able to do at the end of earning this degree? So we started with looking at competencies and outcomes and exam content of what people are being held accountable to. For example, the Joint Commission for Palliative Care Programs has an accreditation process. Certainly the National Consensus Project for Palliative Care Clinical Practice was an incredibly useful resource. And then a variety of board certifications and certification exams, including the American Board of Medical Specialties in Hospice and Palliative Medicine Certification, the Hospice and Palliative Medicine Entrustable Professional Activities from the American Academy of Hospice and Palliative Medicine, the Hospice Medical Director Certification Exam, Advanced Certified Hospice and Palliative Nurse Exam, Certified Hospice and Palliative Nurses, Certified Hospice and Palliative Care Administrators, Advanced Certified Hospice and Palliative Care Social Worker Exam, and the Hospice and Palliative Care Specialty Certification from the Board of Chaplaincy. So putting together all of the terminal performance objectives and the content expectations and the recommendations from these guidelines and these certification exams, we put them all into a big old pot and we stirred and we stirred and we stirred, which is represented from the word cloud, as you can see on the right. And by distilling them down and looking for common themes, we came up with 14 terminal performance objectives that will be accomplished by earning this Master of Science degree. These are the 14 terminal performance objectives. You can see that 4 are shown in purple, and they are specifically interprofessional competency statements. So we certainly, as I said, we practice in an interprofessional way. We should train the same way. So I think nobody does team or interprofessional practice like hospice and palliative care people. Personally, I think we wrote that book. So as you can see here, the terminal performance objectives range from, the first one is apply the knowledge of one's own role and those of other professions to appropriately assess and address the healthcare needs of patients with serious or life-threatening illnesses and their families. Now, I'm not going to read them all to you. You're welcome to pause this video and read them yourself. But what's important for you to know is each of these 14 terminal performance objectives is introduced in the first 4 courses of this master's degree, which gives you that first graduate certificate. And then every single terminal performance objective is emphasized in the elective opportunities that come next. And again, every single terminal performance objective is reinforced in the last 2 courses, which are also core courses. So what do we mean by this? So again, there are 10 courses in the Master of Science program. There are 4 required core courses that everyone takes right out of the gate. Then you have 4 elective opportunities, and we end with the 2 required courses where we all come back together again. These are the first 4 courses: Principles and Practice of Hospice and Palliative Care, Communication and Healthcare Decision-Making, Psychosocial, Cultural, and Spiritual Care, and Symptom Management in Advanced Illness. Now that's more of a basic course because we do have a whole clinical track which is more advanced clinical care. Each of these courses is taught in a fashion subscribing to the principle of self-determined learning and constructivism, where adult learners make their own meaning from their learning, which is why we are able to use multiple interprofessional practitioners in the same course, and they all take away from this what they need to take away relative to their profession in the role of the interprofessional team. Completion of these 4 courses, again, will earn you a graduate certificate, Principles and Practice of Hospice and Palliative Care. And again, you can say, that's it, that's all I want to do, I just want that certificate, and call it a day, or put your training on hold, or continue forward to the next phase, which are the electives. So we do have a whole host of electives, as you can see here. What I really like about this program is that it's not lockstep. I'm not telling you what you have to take. You decide what you want to take, what best meets your educational needs. So as you can see, we do have 4 tracks. For example, the clinical track. We have advanced pain management and opioid dosing, advanced non-pain symptom management, advanced disease state management, and clinical management of special patient populations. If you choose to take all 4 courses in any one track, that gets you another graduate certificate. So in this case, it would be in clinical hospice and palliative care. Similarly, we have a graduate certificate in leadership and administration in hospice and palliative care, psychosocial spiritual aspects of hospice and palliative care, or aging and applied thanatology. However, you don't have to stay in a track. You can say, I think I want to take 1 from each track. You can say, I want to take 2 from this track and 2 from this track. So really, this is true self-directed, self-determined learning so that you can choose how you want to move forward in this degree. After you've completed your 4 electives, all the learners come back together again and complete the last 2 required courses, Research and Outcomes Assessment in Hospice and Palliative Care, where you will work to develop the outline of a project, although you will not have time to implement it during your coursework. And the last course is Advanced Team-Based Palliative Care, where you certainly focus on the whole interprofessional approach to hospice and palliative care, while certainly focusing on your role within the team. Some of the features that I think are important that you be aware of in this program that I think are really the gems of the whole thing. As I've mentioned several times, the self-determined or self-directed aspect of the learning. You decide what best suits your educational needs so that this degree will help you get to where you want to go in your career. I love that it's asynchronous learning. It's absolutely asynchronous. Now, of course, there is quite a bit of group work during the courses, and your group may choose to schedule a conference call or go to Google Hangouts or whatever you choose to do. But we do not, for the most part, have synchronous learning, meaning you have to show up at a certain time. Some people work best at 3 in the morning. That wouldn't be me, but hey, whatever works for you. This program is completely online. There is no need to travel anywhere at any point during this degree. If you'd like to come see me in Baltimore, I'm happy to see you, but you don't have to do that. I've worked very hard to make sure this program has affordable tuition, both in-state, in Maryland, and out-of-state, just for a small increase out-of-state, because this is an online program. So really it doesn't matter if you're in the office next door or you're on a different continent. We have nationally recognized interprofessional faculty. I'm very excited about that. Most of our courses have 2 faculty members from 2 different disciplines to truly give you the interprofessional flavor of what we do in hospice and palliative care. Personally, I think hospice and palliative care wrote the book on the team approach and the interprofessional approach. As I've already shared with you, it's 30 credits or 10 courses for the Master of Science degree. We do have the 5 graduate certificate options. What's really interesting and innovative about this program is each of our, quote, semesters is 8 weeks long. So most people would take 2 courses a semester, but instead of taking 2 courses over 16 weeks where you kind of ping-pong back and forth, instead each course you take over 8 weeks. So you can focus on that course and then really drill down deeply and get what you need to out of that course. So we have Fall A and Fall B, so you will complete 2 courses in the traditional fall semester, but they would be one and then the next one. We have 2 8-week semesters in the traditional spring semester and 1 8-week semester during the summer. And absolutely, international students are welcome in our program of all those disciplines I've already mentioned. You just have to make sure that you have internet access with sufficient speed to access the learning materials. So, in conclusion, you know, I think when I look at this program, of course, I am excited all out of control about it. But why should you do this? I think we have your why. In my opinion, if you're the kind of person who flourishes in the process of discovery and lifelong self-determined learning, who doesn't rest until you have explored every opportunity to achieve absolute fulfillment of your personal mission, that which drives you, who enjoys the process of discovering evidence-based practice and how to translate it into the best possible care for fragile patients desperately needing your care, who thrives in a transdisciplinary practice environment, generating seamless and synergistic best practices care for patients and families affected by serious illness, and relishes contributing your particular expertise to a trust-based, symbiotic team approach to the care of vulnerable patients and their loved ones. Then have we got a deal for you? This is why you were drawn to healthcare. You want to help people? We want to help you do that. This is my favorite expression. It's from Mahatma Gandhi. Live as if you were to die tomorrow. That's how I want to go out, with my tank empty, sliding in maybe with one shoe off. But on the other hand, learn as if you were to live forever. We are all lifelong learners. We owe it to ourselves and to our patients. I urge you to visit our website to learn more about our program. I am always available if you would like to call or to email me, and I hope to see you in the future. Thank you.